To summarize again, or to sum up again, we can say that there is a wide range of scope of pulmonary involvement in patients with renal disease, especially chronic renal disease. As I mentioned, in patients with chronic renal disease, chronic kidney disease, especially in stage 4 and 5 chronic kidney disease, and especially with the classic chronic renal failure, that is the uremic syndrome, we have involvement of the lung in different ways. We have involvement of the lung parenchyma with pulmonary edema, with pulmonary calcifications. We have involvement of the pleura with pleurisy and with pleural effusion. We have involvement of the interstitium with interstitial fibrosis, especially in systemic diseases, which autoimmune diseases, which involve both the kidney and the lung interstitium, as exemplified by vasculitic syndromes, and also many other environmental factors which affect the kidney and the lung together, that is causing interstitial lung disease. So this is the interstitial lung pathology in patients with chronic renal disease and chronic renal failure. Also, there is involvement of the pulmonary vasculature directly and indirectly due to the systemic inflammation and due to the metabolic derangements associated with chronic renal failure and the uremic syndrome. So involvement of the pulmonary vasculature, involvement of the pulmonary parenchyma, involvement of the pulmonary interstitium, involvement of the pulmonary vasculature. It means that all the different tissues of the lower respiratory tract are involved pathologically as sequelae or as a complication of chronic renal disease. So ultimately resulting in restrictive lung disease, that is restrictive ventilatory defect, obstructive ventilatory defect, also perfusion defects, diffusion defects. So it affects all the physiological functions of the lungs. This is the, in short, summary of how is the lung affected physiologically and pathologically in patients with renal disease. Thank you so much, and we'll talk about other issue in my next presentation.